So tummy tucks are one of the most common procedures done in the United States. It's also referred to as an abdominoplasty. There's a few main things that we address anytime we're doing a tummy tuck. So it's typically when patients come in, they're concerned about loose skin, typically in the lower part of the belly, but sometimes that loose skin goes all the way up to the upper part of the belly. People usually also complain about the way their profile looks. So when they look sideways in the mirror, they're concerned that their profile looks a little bit too round. The nice thing about the tummy tuck is it helps both of those problems. So the steps that we include are an incision that we try to hide in a really low position so it hides in almost all clothes that you're gonna wear. We cut out the skin of the lower belly. Once that skin's removed, we take the muscle and we repair that. Muscle usually gets stretched out by a few things. It can be stretched out by weight gain, but the more classic one is pregnancy. So in general, the more children you have, the more the muscles get separated. Tummy tuck's a great way of bringing those muscles back together. As you tie those muscles back together, it really helps to define that hourglass shape. And then another part of abdominoplasty that we typically do for most patients is to liposuction their flanks. Humans are three-dimensional structures, we're not 2D creatures, and so to really get a nice hourglass, usually we want to tighten the front part of your abdomen by taking out the skin, repairing the muscle, and then we bring the flanks in by doing liposuction out here on the sides. It's a procedure that most people are usually very surprised by how well they do with. Some patients come in, they're really concerned about what the recovery is going to be like. We put a lot of attention and effort in terms of pain control. Our patients are typically up the same day of surgery walking around, often take anywhere from 5 to 10 days off work, but for the most part, they're usually, like I said, very pleasantly surprised by how well they do, and it's a procedure that has a really high satisfaction rate. If it's something that you're interested in learning more about, we would encourage you to schedule a consultation. We'll go over your concerns and we'll see if there's a good plan for you.